Kelly here with Mindful Bodyworks. So I haven't posted a video in a while. This video is all about the AC joint or the acromioclavicular joint. And that would be like right here. So if you're having an issue with the acromioclavicular joint, some things that would be hard for you could be reaching across you, reaching up. So some of those things, it would be hard to do. Now, just to tell you a little bit about the joint. So to find it, you would find your clavicle or your collarbone. So if you come down to the center of your throat, you'll feel a notch here. And then if you follow that collarbone all the way over to where it comes into the shoulder. Now you have another bone that comes in here, and that's the acromion. That's coming from the shoulder blade. So those two bones meet in the middle. Now, if you're not anatomy savvy, it doesn't matter. Just know that you have two bones that meet right there, and sometimes you can palpate it and it's tender. There's also 3 ways I'm going to show you real quick that you can test to see if you're having acromioclavicular joint issues or AC joint issues, okay? So one of those is just taking your hands and cupping them together like this, and you're going to pull away, okay? So you're just pulling just like this, and you'll feel a little twinge there usually, depending on how serious it is. You know, it might hurt quite a bit, or it might just be just a little twinge. Another thing that you can do is the scarf test. So you're going to put your hand on the opposite shoulder, and you're going to come into the elbow and push that back, like if you were whipping a scarf up around your neck. And sometimes you'll feel that right there as well. And then the last thing that you can do is just the reach test, where you're just taking your arm across. Now, sometimes you might feel the discomfort or a twinge right here in the front of the shoulder. Sometimes you might feel it up here. A lot of times people do feel it in that anterior portion of the shoulder. That's where I definitely felt it. So usually if you do those 3 tests, the pull apart, the scarf, and then the across the reach test, across the chest, if you have 2 out of 3 of those, that usually says that you have an AC joint issue. However, this is just some real easy stuff that you can do without stressing the joint that can help you. So the first thing is just to get some movement going in that joint. And so I'm going to show you how to do that on a chair, or like the back of your couch would work as well. All right, so holding the back of a chair or the back of a couch, you're just going to bring the arm down that's giving you issues, and we're going to get some motion in it. Now, instead of moving just your arm, you're going to move your whole body so that you're not using the muscles in the joint, but you're freeing up the joint, okay? So you're not using your muscles, you want to use some momentum. So we're going to go forward 10 times, forward and back 10 times. And so I'm really using some momentum with my body. I don't want to just do this, because then I'm using those muscles and tendons around the shoulder. And then you want to go side to side. So think of an elephant trunk, side to side. Again, 10 times. And then you're going to go in circles. So this one sometimes is a little bit hard. You can go one way, and then you can go the opposite direction. So again, 10 circles. Try and use momentum so that you're not flinging that arm around with muscle. Good. Good. All right, guys, so if you're still having AC joint issues and you want to try something else besides just moving the joint with momentum, you can again find that joint. So follow the clavicle over, and you're just going to do like friction massage. Sometimes it's tender, sometimes not so much. So really, it depends, you know, what level of strain or sprain you have there. So just getting some circulation in there. It helps bring fresh nutrients to the injury, which helps to speed healing. So massage is always a great thing, right? All right, so the last thing that you can do, or the last thing I'm going to show you on this video to do, is doing like a Pmf stretch, or like an isometric exercise, okay? So with that, if you watch some of my other videos, we're going to be doing resistance. So for starters, what we want to do is the arm that's giving you trouble, you want to have that elbow tucked into your side, and it has to stay there the whole time. So if you're having trouble with that, you can roll up a little towel and put there, and just holding the towel against your body will keep the elbow over where it's supposed to be. So thumbs up, okay? So I've got my arm in an L, and then I'm going to take the other hand and I'm going to be pushing this direction against my hand. So I'm going to be pushing this way, okay? So it looks just like this. So I'm going to count from 8, 7, 6, 5, 4, 3, 2, 1, and release. And you want to try and do a couple of repetitions with that. So you could hold it for 8 seconds, relax, and then do it again for 8 seconds, maybe 2 or 3 times if it's not too uncomfortable. Now, if it's too uncomfortable, you can just not do that at all. Now, we're going to do the opposite. So we were pushing this direction. So now we're going to be pushing out the opposite direction. So you're just going to have, again, I'm in the L just like this. I'm going to take my other hand and put it on the outside of my hand. And so this time I'm going to be pushing this direction. Now you want to keep your wrist straight because we want to feel this in the joint. We don't want to be doing any fishy wrist, okay? All right, so holding the outside, we're going to count for 8, 7, 6, 5, 4, 3, 2, 1, and release. So again, that is keeping the elbow into the side and going this direction. So I'm pushing against this hand. Now with any kind of resistance, you want to obviously not push past pain. So if it's painful or it's just too uncomfortable, you want to stop. With any of these exercises, the massage as well, you want to challenge yourself, especially when you're getting the joint moving. Challenge yourself to be able to feel it, but not push through any pain, okay? So I hope that those help you. Keep in mind that, like I said, getting a diagnosis from a doctor or seeing a physical therapist is your best bet, but try these at home. And let me know what you think down in the comments. Another alternative that you can do as well, if your arm is just really, really sore and you keep picking stuff up and you keep re-injuring it, you can always sling it at home, like with a scarf. Now keep in mind, anytime you sling your arm, you don't want to sling it for long because the shoulder needs that movement. So if you put your arm in a sling, just to kind of baby it for maybe a day, you definitely want to make sure that you're getting that motion back in the arm, because if you sling it too long, you can end up getting kind of like a frozen shoulder or more of a limited range of motion. So you'll just create more issues. So just don't sling it for too long, okay? So I hope that helps you. Please take care of yourself, and I will see you next time.